Hello, it's Rafael Gutierrez, and today I'm going to talk about the elbow. And one of the questions I will ask you is, how many people do you know have elbow pain, either when they train in martial arts or a couple days after they train in martial arts? And what is it? Have you ever wondered what it is that's causing this person to have elbow pain? And today that's really what I'm going to talk about. Now, to understand what we're dealing with, I do want to show you the pictures of what's called the humerus and the ulna. Humerus is a big bone that lies here. Ulna would be following your little finger here. And you can actually feel the bone all the way up to about the wrist here. Now, if we were to look at it, and I'm using my book again. I like the pictures that I borrowed. They are fair use, so you can find them online and use them yourself. But one of the things you see here is you can see how the humerus here is attached to the ulna over here. And it's a thin bone here. And at this end, it's where it's really connected to the humerus. Now, if I use another picture, you'll see the back on how it's connected. So here, in this picture, you can see the front. This is a radius here, and the back here, this is the ulna. Now, the ulna, you can see the humerus here, and you can see how the ulna goes into the humerus. That area of the ulna, for those of you who take anatomy and are interested, is called the olecranon process, and the little groove it goes into is called the olecranon fossa. And so the ulna goes into that. Now, it actually is a hinge joint, and there are some people who are more flexible than others. And so that's actually one of the things that can happen is you have some people who are more flexible, and so when they punch and they use their triceps to drive force, instead of coming straight, which if you take your arm and you pull it as far as it goes, that's straight. If you go beyond this, you can see in my elbow here, this is straight. If I go beyond this, I can get a little more over there, but it's no longer straight. And you start doing damage to you can actually do damage to your joints, your ligaments, especially depending on how hard you hit. And if you stick with that and you're hyperextending, you can end up doing damage to your ligaments because as your bone is now, instead of going straight, it's bent the other way. It can actually be pushed beyond. That's actually also one of the big reasons why it's important if you do Brazilian Jiu-Jitsu for you to tap out. It's actually funny. Some of the people I've met I've met a couple of people who are advanced in Jiu-Jitsu and Judo, and they say that you can always tell the beginners from the advanced. The advanced are willing to tap out once they know that you got them. The beginners are fighting tapping out. So a lot of times something goes wrong, and then if you don't pay attention to your body, you end up having to quit training. Now, that's not the place's fault or the person who has the joint's fault. That's the person who didn't tap's fault. And by the way, that's actually one of the reasons why judges in MMA are so important. If you think about it, you have people who are not going to tap until the ref says, okay, he has nothing. And then, of course, what's funny is they stand up and it's like, oh, I would have been able to get out of it. I would have had 5 more minutes. And, they were not getting up. They're not getting out of it. Their elbow's going to be dislocated. But the thing is, these hyper extension of your elbow can actually happen if you're punching wrong or if you're not tapping out when someone has you in some sort of elbow lock where they're putting pressure on you. Now, a lot of ways you can do this. Like I said, you can do this to yourself. You can feel, see if you're actually hyperextending or if you are going straight. If you are hyperextending, it is important for you to fix that. If you don't know, if you want to check, go to a qualified instructor. Have him do this to you, and he'll tell you what you're doing wrong and where you want to be when you punch. Again, remember, it's the human body. A lot of people talk about how human bodies are different, and yes, they are. But for the most part, 99% of people will have similar anatomy, especially in bones. And when you do have something which is different, usually it's actually detrimental. So make sure you're actually training correct and intelligent, not just thinking, okay, I'm just going to punch and do it as hard as I can. If it hurts, no pain, no gain. That's the worst idea you can have, especially when you start getting into higher ranks when you're actually punching to a point where you can damage your body, your shoulders, if you don't actually hold them back the right way. So I am going to put the video on what I did. I hope you enjoy it. And if you are watching this and you want to promote your school, please, you're more than welcome. to put on comments that that you like the video and what school you're at, or if you don't like the video, you can put you don't like the video, that you think I'm a fraud, and you can put your school there too. So hopefully, I do hope you enjoy it and take the first option. Have a good day.
People think they're extending, but what they're doing is they're hyperextending, and this is actually what it looks like. It's actually coming at an angle here. In reality, relax. That's actually extended perfectly. You okay? Mm-hmm. So that's extended perfectly. The problem with hyperextending is you can actually tear some of the tendons that hold up the elbow. You can also end up doing damage to the joint itself. So using the skeleton to show you what it is, you have actually a couple bones that are important. Now over here you have the ulna, you have the humerus here, this is a radius. When you look at the joint, again, hyperextension would be here, where you're actually going beyond the normal angle of the bone. Really, you want to actually extend, so it's actually pulled perfect, and so it doesn't damage the joint. There you go.
Now, if you do find yourself with elbow pain, the first thing I would actually recommend you do is make an appointment to see a doctor, a medical professional, physical therapist, anyone who actually deals with these joint problems. While you're waiting for it, they will probably recommend what they call RICE, which is rest, make sure that you rest the joint. Ice, you actually do want to put a little bit of ice on it to help get the swelling down a little bit. You can compress, which actually does help a little bit. And you can elevate it. So elevate it a little higher than your heart and just keep it about here. And that way you end up getting the blood flow a little better. So that's actually the nice thing to do after you're done, after you've committed something that's going to cause an injury on you. Hope you enjoy it. Have a good day.